Today, we are going to be talking about some of the most commonly held beliefs surrounding back pain that may not necessarily be true and could be inhibiting your recovery. The first of these is that movement will make my back pain worse. Although it is true that some movements can be uncomfortable when you have back pain, it is well established that returning to movement and work as soon as you are able is better for recovery and preventing it from returning than just resting. Often people fear twisting and bending, but it is actually essential to keep moving in order to keep your back happy. Start small and then gradually increase how much you are doing as your confidence improves. Try to stay on the go and don't sit down for too long at once. The second myth is that exercise should be avoided for people with back pain, especially weight training. However, exercise is actually generally accepted as the best modality for treating lower back pain in both the acute and chronic phases, and it is recommended as part of the NICE guidelines. Studies have shown that various types of exercise are extremely beneficial and safe. And interestingly, there is no one type of exercise that has been proven to be better or worse for back pain. So try and find a type of exercise that you enjoy, that you can tolerate, and most importantly, you can do regularly. Again, start with a small amount and gradually build this up as your confidence and ability improves. Myth number 3 is that a scan will show exactly what is wrong. On the contrast, there is strong evidence that the results of scans correlate poorly with symptoms in people with low back pain, and also that most people without any symptoms of low back pain have signs of degenerative change and disc bulges on scans and x-rays. It is very normal to have changes associated with wear and tear in the spine and other joints, even from your early 20s, and the prevalence increases with age. As a result, imaging alone is not capable of telling us exactly why someone is experiencing pain. In fact, there is evidence to suggest that in some cases, having a scan can make situations worse. Lastly, we have one of the most commonly held beliefs, that pain equals damage. The level of pain experienced is often not proportional to the amount of actual tissue injury sustained to the back. Pain and the reasons for it are very complex and specific to each individual. Factors such as past experience, general health, diet, beliefs, amount and quality of sleep, exercise levels, and psychological well-being all contribute to how an individual experiences pain, and it can often continue past the point of when we would expect tissue healing to have occurred, as we mentioned before when talking about chronic pain. Modern physiotherapy takes a holistic approach that helps people understand why they are in pain and what they can do to manage it. Thank you for listening.